Okay, hello all. Assalamualaikum. My name is Nur Amira Aisha binti Shaharuddin, and today I'm going to present to you about PTSD, that stands for Post-Traumatic Stress Disorder. Okay, right now, let's look for the definition of PTSD. Is it a mental health condition that can occur after someone experienced or witnessed a traumatic event, such as an accident, assault, or disaster? Symptoms may include flashback, avoidance of reminder of the trauma, heightened anxiety, and changes in mood. Next, let's talk about the symptoms. The first symptoms of PTSD is re-experiencing. Nightmare, flashback, or intrusive memories about the event can occur with PTSD. Next is avoidance. Avoid places or people or activities that remind them of the trauma. Third is changes in mood. Increased irritability, sadness, or withdrawal from friends and activities. 4. Physical symptoms. Complain of headache or stomachache without a medical causes. And lastly, difficulty on concentrating. Trouble focusing in school or during daily activities. It is important for you or anyone to recognize, design, and seek help from mental health professional as early as intervention can make a significant difference in recovery. Alright, now let's check for the factors. First, the factor is type of trauma. Exposure to severe or prolonged traumatic events such as combat, sexual assault, or severe accident can increase the risk. Second, personal histories. A history of trauma, mental issues, or substance abuse can make an individual more susceptible. Third, biological factors. Genetic predisposition and difference in brain structure or function can influence vulnerability. Fourth, coping mechanism. Ineffective coping strategies or lack of social support can hinder recovery and increase the risk of PTSD. Next, development factor. For children and teens, age and developmental stage can affect how they process trauma and express symptoms. And lastly, environmental stressor. Ongoing stressor such as poverty or family instability can exacerbate symptoms and complicate the recovery. Alright, who get PTSD? Anyone can develop PTSD at any age, including combat veterans and those who have experienced or witnessed trauma such as assault, accident, or disaster. About 6% of people will experience PTSD in their lifetime, with women being more likely to develop it than men. Now, let's see how do children react to trauma. Children under age of 6 that may have severe trauma might wetting their bed after having learned to use toilet, forgetting how to talk or being unable to talk, acting out that the scary event during playtime, and being usually clingy with a parent or adult. Older children and teens usually show symptoms more like those seen in adults. They also may develop disrespectful, and destructive behavior. Older children and teens may feel guilty for not preventing injury or death. They may also have thought of revenge. Risk factor. Being exposed to previous traumatic experience, particularly during childhood. Second, getting hurt or seeing people hurt or killed. Third, feeling horror or helplessness or extreme fear. Next, having little to no social support after the event. Dealing with extra stress after the event, such as loss of loved one, pain and injury, or loss of job or home. Lastly, having a personal or family history of mental illness or substance use. There are many treatments that we can seek for, as the main treatment are psychotherapy, medication, or a combination of psychotherapy and medication. Mental health professionals can help people find the best treatment plan for their symptoms and needs. Treatment is usually more effective when it addresses both the traumatic situation and the symptom of PTSD. People who experience traumatic event or who have PTSD also may experience panic disorder, depression, substance use, or suicidal thoughts. Treatment for these conditions can help with recovery after trauma. Research shows that support from family and friends can also be important for the part of our recovery. In conclusion, PTSD affects individuals of all ages, including children and teens, that can lead to a range of debilitating symptoms that impact daily life. Support from mental health professionals, family, and friends is essential in helping those affected navigate their experience and works toward healing. Understanding PTSD is vital for fostering empathy and ensuring that individuals receive the help that they need. Thank you, and let's help others that need our help.